Hi, my name is Logan Harper, and I'm a family doctor at the University of Colorado, here to talk to you about the health impacts of extreme heat. So, we know climate change is worsening extreme heat in the US, and that's resulted in a significant increase in heat related deaths since 2016, with about a 16% increase every year. This culminated in a record 2,325 heat related deaths in 2023, which exceeds all other deaths from extreme weather events combined. So, how does heat make us sick? First, we need to understand how our bodies normally adapt to heat. And it starts with a shunting of blood from the core out to the periphery, so out to your arms and legs and into the blood vessels near your skin, which allows for more heat to dissipate into the environment. In order to accomplish this, your heart has to beat harder and faster. And if you have underlying cardiovascular disease, this can make it much worse. It can even cause a heart attack. And that's why cardiovascular disease is the number one cause of heat related death. In addition to the shunting of blood to the periphery, we also sweat more, which can make us dehydrated. And when you get dehydrated, you have less water in your blood and you get lower blood volume, which makes it even more difficult for the heart to get adequate blood flow to the critical internal organs as well as out to the skin. And when you have decreased blood flow to internal organs, you can have what's called ischemia or cell death due to lack of blood flow and sufficient oxygen. And this can cause organ failure pretty much anywhere in your body. But I wanted to highlight something that happens in the gut. When you have cell death in the cells of the wall of the gut, this can allow toxins and bacteria from inside the gut to translocate that wall into the bloodstream, causing sepsis, widespread inflammation, and increasing your risk of critical organ failure throughout the body and even death. So, who's at highest risk of heat related illness? There's really two buckets to pay attention here. Pay attention to. The first is physical risk factors. So, that would be the very young and very old, people who are pregnant, people who have chronic physical or mental health conditions, and people who take certain medications or use recreational substances that can increase their risk. The second bucket are those that experience a lot of heat exposure or are unable to remove themselves from heat exposure. And that includes people who live or work outside, outdoor athletes, people living in urban heat islands, living in poverty, immigrants, folks who don't speak English, and racial and ethnic minorities. I wanted to highlight medications because they're a commonly under recognized risk factor for heat. And there are several different meds that can impact your risk, but a few different key categories include those that impact the brain. So the brain is responsible for regulating your body's temperature, but some meds can impair its ability to do that. And those would include certain stimulants like Adderall and cocaine, psych meds like antipsychotics and some antidepressants. And then there's those that reduce your ability to sweat. Benadryl is a common culprit here. Anything that regulates your heart's ability to beat hard and fast, so many different blood pressure and cardiac meds can reduce your body's ability to respond to heat and cause it to heat up more than it should. And then, of course, anything that makes us dehydrated, that includes water pills, laxatives, anything that might reduce our thirst, those can increase your risk as well. So heat illness exists on a spectrum. On the left side, the mild side, we have things like heat rash, heat cramps, heat edema, and heat syncope. Heat syncope is loss of consciousness due to reduced blood flow to the brain from dehydration and vasodilation, but it's brief and you can quickly recover from it. Then we have the moderate severity condition of heat exhaustion and the severe condition of heat stroke. So differentiating these is very important for understanding how to respond and keep people safe from heat-related illness. This can be tough with heat exhaustion and heat stroke because they have a lot of overlapping symptoms. Both can present with fast heart rate, low blood pressure, headache, dizziness, nausea, and vomiting. But there are a few key things that set heat stroke apart. First of all of those symptoms tend to be worse. People's core body temperature is over 40 degrees Celsius or 104 degrees Fahrenheit, although you might have difficulty knowing this in the field without a thermometer. And the key thing to look for is signs that the brain is overheating. So that can include symptoms of altered consciousness or confusion, or even in a severe case, folks can have seizures or severe agitation. One other thing to note, often in heat stroke, the skin can become hot and dry. People can stop sweating, but this isn't always true. So if you have a very sweaty patient who is exhibiting all these other symptoms of heat stroke, don't rule it out. Heat stroke has an extremely high mortality rate ranging from about 33 to 80%. So what do we do to treat these heat conditions? On the mild side of the spectrum, you want to focus on rehydration, rest, and removing people from the source of heat until they start to feel better. And then they can go back to their prior activities. With heat exhaustion, we want to more aggressively and proactively cool people off. That can include, ideally moving them somewhere with air conditioning, but other tools can include removing all their excess clothing, putting cold water onto the remaining clothing that they have on or on their head, packing cold compresses or ice packs into their neck, armpits, and groin, or fanning them as best you can. If they don't improve or they get any worse within a short period of time of starting these interventions, they should get medical attention immediately. Heat stroke is a medical emergency with a high mortality rate, as we've discussed. So the first step should be calling 911. Next, you should do whatever you can to cool them off, the same as you would for heat exhaustion. But keep in mind that folks with altered mental status or an overheated brain may not be able to take a cold shower or drink safely because they might aspirate some of the fluid into their lungs. Thank you for listening. I hope you learned something about heat illness and how to respond to it. It's extremely important to recognize which heat illness you're dealing with so that you can give people the right treatment at the right time.